Is wheat sensitivity real? Gluten sensitivity, wheat sensitivity. You see it on the news, a new study comes out, and it's BS. That's not a thing, so all you people not eating gluten are crazy. Then you hear some information that gluten's a real problem. It causes leaky gut. So what do you believe? We're going to delve into that today, and this is a huge topic, so we'll just kind of touch on some areas of it, get to some of the main points, and then go from there. How common is non-celiac gluten sensitivity? There's a range of numbers. Some people will say 1 in 7 people have some sort of gluten-related disorder. I've also seen some studies showing that, or estimating that it may occur in as many as 1 in 20 Americans. So it is fairly common. So this is something that I continue to want to educate about so that if this is a cause of issues, we can get to the bottom of it. Celiac disease is an autoimmune disease. It's characterized by an inflammatory immune response to wheat, barley, gluten, rye, and other related proteins. It results in disruption of normal gut tissue structure, and this includes typically an atrophy of the epithelial cell projections that are called villi. It's little finger-like projections in the gut. There's an enlargement of intestinal crypts, and new epithelial cells will form from stem cells there. So we can see basically that there's damage to the gut lining. There are some other blood markers, which we'll talk about in a moment, that are used to diagnose celiac disease. The gold standard, though, if you go to your GI doctor, is going to be an intestinal biopsy to look for, to see if that damage is happening in the gut. So that's celiac disease, an overview of it. Non-celiac wheat sensitivity, also called non-celiac gluten sensitivity, it's a term that's applied to individuals who experience symptoms in response to wheat or gluten ingestion. We're going to talk about some people who may have some sensitivity to wheat or gluten, but they don't have symptoms, because that's possible too. That is also possible with celiac disease. There is something called silent celiac, which can manifest as common as neurological types of symptoms, brain issues, nerve issues. There can be some other things too that someone may go to their doctor for. Typically, it takes longer to figure out what's going on, but what they end up finding out is that they have celiac disease, and that is caused enough damage that they're getting these other symptoms. So back to non-celiac gluten sensitivity, common symptoms can be obvious, like digestive related symptoms, IBS type symptoms, bloating, gas, diarrhea, constipation, irregular bowels. Somebody may find out that they have low vitamin D, which could be related to a lack of getting out in the sun and getting those vitamin D levels up, but it could be some malabsorption issues in the gut too. Low B12, which can also relate to low energy or fatigue. Brain fog, really common, difficulty concentrating. Energy in general, like low energy. Leaky gut type of issues that can also relate to autoimmunity or autoimmune issues. Skin inflammation, eczema, is quite common with gluten sensitivity. Chronic headaches or migraines. Weight gain, weight loss. Weight loss is one that can happen too if that's causing a lot of damage to the gut and there's a lot of malabsorption. We might see weight loss. Joint pain, numbness in the fingers and joints, depression, anxiety. There can also be panic attacks or panic types of disorders that are related to gluten. So be aware of that as well. So what is it about gluten or wheat that's causing such a problem? Like most things in health or nutrition, it's not black and white. So let's talk about some of the main factors that may be playing a role. One, there was a study, I think it was a few years back, that made big headlines and said gluten sensitivity is not real. It's actually the FODMAPs that are in wheat containing foods that are causing problems. So they looked at people with IBS and found that people who were eating isolated gluten, that didn't cause an issue, but the FODMAPs did cause a problem. So FODMAP stands for fructo oligosaccharide disaccharide monosaccharide and polyols. And those are basically carbohydrates that act as prebiotics in food. They feed our gut bacteria. This is a good thing. We want prebiotics in our diet. And so if our bacteria is in a good balance, if our microbiome is healthy, then oftentimes we will tolerate or do great with foods that contain FODMAPs. If our bacteria is out of balance, or we have an overgrowth like SIBO or some other microbiome usually related issues, those FODMAPs might cause bloating, they might cause constipation or diarrhea. And wheat in food does have FODMAPs. And so this certainly can play a role, and it can be that someone may find that when they eat wheat, it causes problems, and that it's actually related to the FODMAPs, which usually means that they're reacting to FODMAPs in other foods as well. And so when they go on a low FODMAP diet, they do a bit better. I didn't give you the details on that study here verbally, but I will link the study to this if you want to go read more of the details on that. The takeaway there is that FODMAPs could be the issue in wheat. So what is it that gluten does? How does that interact in our gut? Let's talk about that. Gliadin is a component of gluten that has an effect on the integrity of the intestinal barrier. And so what it does is it can trigger an immune response in some patients. Dr. Alessio Fasano is a leading researcher in this area looking at intestinal permeability. And there was a study done from his lab that took duodenal biopsies from 4 populations. There were patients with celiac disease, patients in remission from celiac disease, patients with gluten sensitivity, and patients with no gluten sensitivity. They exposed all 4 groups to ingestion of gliadin, and all 4 groups had an increase in markers of intestinal permeability. So we can see that no matter what someone's reaction is to gluten, they get an increase in intestinal permeability due to the gliadin protein. So what's going on there? Gliadin stimulates zonulin, and zonulin is a protein that regulates the opening and the closing of the tight junctions in the gut. So we've got our intestinal cells. In between these guys, we've got these things called tight junctions, and those tight junctions keep those cells nice and tight and closed. There's a couple things that will stimulate zonulin. Bacteria is one. Gliadin in gluten is another. And when those get opened, we can have undigested food particles or bacteria that slip through the lining of the gut, get into the circulation. Once we're over here in the circulation, if that is some sort of component like bacteria or an undigested food particle that is not supposed to be there, we get an inflammatory response. And then the body is going to deal with that accordingly. And so we can end up, this is kind of the definition of leaky gut, right? We have some damage to the gut lining. We get things leaking throughout into the gut, and we call that intestinal permeability. And it can cause low-level inflammation. It is associated with autoimmune disease or autoimmunity, among other things, just including chronic inflammation. So how do we determine if this is actually a problem for an individual? There's a test called the Wheat Zoomer test by Vibrant Wellness. It's an awesome test. Cyrex also has a very good one. I tend to use the Vibrant Wellness option. And it looks at an array of different antibodies to the gluten and gliadin proteins, but it doesn't just look at the proteins, it actually goes to the peptide level of the gluten and gliadin proteins and looks to see if there's an antibody reaction to those proteins. And so that's what it's measuring in large part. And then there's a component of the test that has leaky gut markers. LPS is an important marker found on the Wheat Zoomer leaky gut portion of that test. It stands for lipopolysaccharide, and it is an endotoxin that is produced by many different strains of gram-negative bacteria that can inhabit the small intestine. LPS lines the outer membrane of the bacteria like C. diff, and that can protect the bacteria and allow it to live in harsh environments. So if we see that LPS is higher, and then the test also looks for anti-LPS, So antibodies against LPS, we know that the immune system is also reacting to the presence of that LPS in the body. So that's really interesting. The test also looks for levels of zonulin, which we talked about, anti-actin antibodies, IgG, IgA, and also anti-zonulin antibodies, IgG and IgA antibodies. And so all of these can give us an idea of what's happening as far as intestinal permeability. So we get that along with the antibodies to the different peptides in the gliadin and gluten proteins. And so we get a pretty good picture of if we are having immune responses to gluten and wheat. And it does also look at wheat starch as well. So somebody could not be reacting to gluten, but they're reacting to wheat starch, which is found in some foods as well with the absence of gluten. So that is good to know. So it's a really comprehensive test. It's really, really helpful for determining if you're confused. And this is really what I run into with a lot of people, is that they read this information or they hear about it, and then they wonder, how do I figure this out for myself? And a lab test is just one piece of information. So I was speaking with Andrea Klunder on The Creative Imposter. It was super fun. Thank you, Andrea, for having me on your show. And we were talking about what happens when you don't really have a reaction to gluten, but then you get these positive results back. And so ultimately, based on the lab, the recommendation is to avoid gluten if you have some markers of leaky gut and we see that there's a response to gluten. We know that even if we're not having symptoms when we eat gluten, there is some immune response and inflammation happening in the gut from that food, and it is potentially playing a role in some of the leaky gut markers that show up. Now, this being said, we can do some additional digging, because if leaky gut is present, it may not be that it's from the gluten. It probably I would say it's likely it could be playing a role, but we don't know for sure. And certainly there could be some things playing a bigger role, like stress. Stress can very much affect the gut. So we want to assess for stress levels and transforming stress, relaxing while we eat, being in our parasympathetic nervous system while we eat, and that whole conversation. We also want to look at the microbiome. So we might want to do a stool culture to check and see what is the balance of bacteria in the gut. Do we have any not optimal bacteria, or opportunistic or pathogenic strains? What are the levels of the good bacteria? Are there parasites? Is there an overgrowth of yeast? How are we digesting? And if we don't have great markers of digestion, what else could be affecting that? So we want to keep looking to see what are some of the other factors that could be present that could be causing some of the leaky gut, which can also help us better assess whether eating gluten is a good idea or not. And one of the big topics that comes up is stress around removing a food. So I'm going to finish with that, because when we're told to remove a food that we might be emotionally connected to for whatever reason, it could be that there was traditions in our family to eat that food. It might make us remember something that we found enjoyable. We might technically be like a little physiologically addicted to that food as well. So there's a lot of factors that come up. Part of my job is to kind of get to the mind root cause of the connection or the need for that food. And then what do we do with it? And I won't even say what we do with it, because it's going to look different for everybody. And the ultimate goal is to get us healthier. So there can be different ways that we do that. So that is an overview of gluten sensitivity. If you're confused about gluten, wheat, all that confusing information out there, I hope that this cleared some of that up for you. Follow me at wiredandtiredwomen.com. You can sign up for my email list and get these articles, blogs, or sometimes even just motivational emails straight to your inbox. I also post regularly on Instagram. It's instagram.com/Brooke Seiz the Day. Thank you so much for watching. I hope this helped if you're confused about this topic. And stay tuned. I will continue to put out more information on this and other health-related topics. Have a lovely day.